Next up, one of the projects that we've been doing here at Encoda is the Practice and Focus Spotlight. For this month, we wanted to have Bassett Medical Center and Bassett Healthcare Network. And for this introduction, we have the Division Chief of Hematology and Oncology, Dr. Anush Patel.
Oh, that's a nice picture. Thank you. Thank you, Josh and Encoda, for letting us be part of this webinar today. My name is Anush Patel. I am one of the medical oncologists, hematologist. I'm here with Christina Loeffler, who is our infusion nurse, with Carrie Buck and Terry Potter, who are patient care coordinator. They handle all of our oral oncolytic drugs. So we are in upstate New York, very rural area. We cover about 8 counties, and our drainage is about 400,000 to 500,000 patients. So it's a relatively large area. Our offices are spread out in 5 clinics. We have 10 providers. We are 8 now, we'll be 10 in a month. I just got some numbers that we have about 200 plus patients who are on oral oncolytic drugs handled by Carrie and Terry very proficiently. And we had about 20 new patients on oral drugs every month. And as you all know, that this volume keeps increasing as time goes by. We are hospital-based system, so we do not have any of our own oncology dispensing pharmacy, though we do have a regular pharmacy that does not dispense any oncology drug, which we'll look into in future to how to have our own oncology dispensing pharmacy. We also provide significant amount of support to patients in sense of we have 3 nurse navigators. Also, we have our own 2 social workers dedicated to our oncology practice. We added a nutritionist to our practice about a year ago, and she had made a significant difference in patient nutrition and their well-being. We do provide a financial assistance in sense of we have our own financial counselor who evaluates and checks on each and every patient's insurance to make sure they have proper coverage, and which limits the out-of-pocket drug cost and copays. Also, our patient care coordinator, Terry and Carrie, also works very hard to get any sort of grant or patient assistance which is out there. And we're hoping to get some more insight into how to do that better. As we are quite rural, patients may drive up to 100 miles in bad weather in their cars that's from 1980s in winter to see us. So we have our own transportation system. We have 3 vans and drivers. They go pick them up and drop them off back home, no matter how far they live. So those elderly patients or disabled don't have to drive in this terrible weather. Though most of the weather is beautiful, like today. Also, we have a cancer survivorship program where when someone is done with their aggressive chemotherapy or surgery or radiation, we help them get back to the normal routine. So I think I would say we do have quite a comprehensive approach to cancer care. And we are happy to be and very lucky to be part of Encoda and having a great team. In our cancer center, we have about 90 members total in our cancer treatment center between all our 5 centers. So we are fortunate to have enough support system for us to take care of our patients. I can keep talking. Let me know when I need to end, Josh.
No, that was great, Dr. Patel. If there's any questions for Dr. Patel at the moment, feel free to raise your hand or type anything in the chat.
Yeah, I wanted to know if he's an OCM.
No, so we are not OCM. We thought of doing OCM last year, but at that time we were in our administrators were changing, so we did not. We were pre-qualified, but we did not sign up for OCM, and I think I regret that. We should have been OCM.
Well, do you know how you did on your MIP scores then for 2017?
You know, I don't have data in front of me now, and I know that our hospital is collecting all the MIPS data. Of course, you know, we are a 500 plus provider practice, so a lot of MIPS is going to be driven by our primary care, which is we have probably 80 or 90 primary care physicians total. But you know, our hospital is collecting all the MIPS data, and I don't know the exact numbers, but I think I'm hoping by the end of this year we are close to where we need to be. Otherwise, we'll start losing money.
Well, thank you. I guess I was wondering, your dispensing pharmacy then, it's affiliated with the hospital?
Right. So we all are hospital employed. We are hospital based. So we don't have our own dispensing oncology pharmacy. The hospital just has a dispensing pharmacy, and we are trying to work with them to start an oncology dispensing pharmacy in near future, especially under 340B if we could, because we are so rural.
Yeah.
Thank you, Dr. Patel. And then that's definitely why Encoda is here to help with dispensing oral oncolytics. So for anyone that wants more information, we have posted Bassett Healthcare Network's Practice and Focus on the Encoda website. You can view that at ncoda.org.